Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in adult transgender care. Welcome to my channel. If you're new here or you have not had a chance yet to subscribe, please do subscribe. This way you are helping me continue to create this content. You're helping a lot of other people also find this content, so I would really appreciate if you subscribe. If you don't yet follow me on Instagram, a link is below. Also follow me. I would love to connect with all of you. Before I jump into the video, last time in a previous video I mentioned doing a wimpy makeup look, and a lot of you said yes to the wimpy makeup look. We would like to see it on YouTube. A lot of you who are especially into makeup, into maybe a little bit more well, I don't know, what would you call this, is wimpy and also maybe a little bit 1920s style of makeup. So this is me sharing with all of you my wimpy look. I think for this look we're gonna have to ditch the glasses so that you can actually see the effect of the eyeshadow, which makes me think I should get maybe contact lenses just for this look. But yes, this is a little bit different to share with all of my trans sisters who are part of this community. If you are especially into makeup, makeup is not for everybody. Not everybody loves or enjoys makeup. But if you are into makeup, there's so many YouTube individuals who do amazing tutorials, who do amazing lessons. People always ask me how I do my eyeliner, for example. And I always have to remind all of you that none of us, there is not a single woman on this planet, maybe like 1.1%, that innately knows how to apply makeup. They're innately very good at it. The rest of us had to learn, and we learned by trying things on. We learned by practicing and playing with makeup and getting a ton of things wrong. To this day I'm still learning. As you can see, this new look is something that I recently learned. I came across YouTuber and I loved this look so much on her, and I thought, you know what, maybe I should give it a try and ditch my red lipstick. So my point is, if you want to get into makeup and you love makeup, again, you don't need it. Makeup doesn't define your womanhood. Makeup doesn't define you as women. But there are those of us who love and enjoy it, and that's great. And if you don't, that's great too. But if you are, YouTube is there for you. You can learn a ton from YouTube. So having said that, today's video, I want to share with you why it actually might benefit some of you to start feminizing hormones. This is video only for people who are interested in feminizing hormones. This is not a video about people who are interested in testosterone. The same does not apply to testosterone. So in case if you started watching this video and you are trans-masc, non-binary, who wants to dabble into testosterone, this is not the video for you. This video is for anybody out there who is on the feminizing hormones, interested on starting feminizing hormones in any dose, microdosing or a regular regimen. And I want to share what I think a lot of practitioners don't sometimes also share and talk about, and that is when it's actually might be beneficial to start feminizing hormones and then to actually stop feminizing hormones and then start again, hopefully start again. And for what individual psychological types it is especially helpful to do start and stop type of thing. I have a video on this YouTube where I talk about why it's not good yo-yoing on hormones, meaning starting and stopping, starting and stopping. And so for those of you who've seen that video, you might wonder if this is almost counterintuitive to that advice. And it's not, it's actually different. The video on yo-yoing on hormones, meaning you start, you stop, you start, you stop, for whatever reasons. And the reason why that's not a good thing to do is because every time you stop, you're eradicating any momentum you have. And as a result, you're diluting and you're thinning out commitment you have for yourself. So this is why it's actually quite better to start and just keep going and keep going if you can, because you build up on that momentum. You are compounding that momentum, and then you can capitalize on that momentum. So that advice still stands. Today's advice on benefits of starting for, I would say, 1 month, maybe even 2 months, feminizing hormones, and then stopping. is a great advice that I found in my practice that is specifically conducive and is very helpful to individuals who are in a state of mind questioning either, is it worth it? Should I transition? Is it worth it? Questioning, is this actually going to help my dysphoria? Is this going to make my life better? Stopping and starting hormones is for those of you who know and want to evolve into your feminine selves. In your cases, I advise commit to yourself and stick to it. But I know that there's a lot of people, especially people who are intellectual type, meaning there's in Jungian psychology, there are two primary types of individuals. There's thinking type and feeling type. So thinking type has nothing to do with intelligence. It has nothing to do with how smart you are. It has to do with the way you process information. So when things happen or when you're in a stressful situation, you process information through your thinking brain. You think into your logic. You think into your analytical thinking. Feeling types, on the other hand, are individuals who process information first through how they feel about information, right? So, example, car accident happened. A thinking type would be calm, composed, would be logically thinking, I need to documents, who do I need to call, making sure that they're all right, they're not harmed. Feeling type would first perhaps even have an emotional, strong reaction to it, maybe sit with how they feel about it, maybe feel a little bit discombobulated as a result of it. Neither one of the function is better or worse. They're just two different ways we process information. Ideally, the goal is, for us as human beings, is to have both in some kind of equilibrium. You don't want to be extreme one or extreme another. To give you an example, I am an extreme thinking function, and as a result, actually struggle from it. And over the years, my goal, my inner work has been on trying to move myself closer to feeling function, and I have gotten better and better and better at it. And now in my 40s, I am feeling a little bit more balanced. But for majority of my 20s and my 30s, I was very, very thinking function. So this is just to give you an idea. So for those of you, as you're watching this, you can just identify where you are on a spectrum of the way we tend to process the information and respond to the world. If you are thinking function, if you are especially extreme thinking function, and I work with so many of you who are thinking function, I think a lot of individuals who were assigned male at birth tend to be thinking function, not because men are predominating in thinking function by any means, but because you have been then conditioned further by society and the world to move further away from your feeling function, right? Think about little boys. When they hurt themselves, they're crying, they come to their mom or they come to their dad and they say, I hurt myself, and they're in touch with their feelings. Most of the time, parents will try to raise little boys to be strong. Most of the time, fathers will say, stop crying, get over it, you're gonna be fine, right? We tend to baby girls and we tend to kind of instill this in my idea, stupid idea of strengths in boys, which I think everybody needs regardless. And as a result of society and family and upbringing, a lot of individuals who were assigned male at birth end up really becoming thinking function. So a lot of the clients I work with who are trans women have a lot of thinking function. And as a result, it can really create quite a lot of obstacles as you try to move into your authentic path. One of the reasons why it creates so many obstacles for you is because you're overthinking everything. I made a real video on Instagram talking about how so many of my trans women clients have this strong need to know how transition is going to work out, know whether they're going to pass for sure, know for sure how it's all going to be laid out for them. And until they know, they're not going to take a step forward. And actually, this arose out of working with so many clients, and I point out to my clients, you are approaching gender transition the way a man would approach a problem. I gotta fix it. I gotta fix it. What's broken? I gotta fix it. Let's have a plan. Transition, while it is important to have goals and some plan, is not like that. Transition is quite, in terms of energies, it's a very feminine energy because there's a lot of flow to it, there's a lot of receptivity to it, there's a lot of unknown, there's a lot of ups and changes. So as a result, you can't approach it in a linear fashion, right? Which is very masculine energy. You have to approach it in a much more fluid, like a river fashion. It's not a straight path. It's kind of like a wavy way that it tends to go and takes you in all sorts of directions. And this comes from individuals being so in their thinking function to the point where they are approaching something that requires fluidity and flow from this very rigid mindset. And for those individuals who are very think and function, if you're watching, chances are you probably are one of them, you will notice that before you even started transition, a lot of you were negotiating, bargaining within your headspaces, and you were constantly trying to logically and analytically weigh out everything and get yourself as close to a certainty before you step into anything, right? And a lot of you especially, and other things that a lot of you have been doing as a thinking function, is constantly asking yourselves those questions that your mind is not really meant to solve. Remember, gender dysphoria is not something a mind is meant to solve. It's not a mind problem. If we were capable of solving it through our logic and analytical mindset, people would not have a need to go through gender transition. People would have no need to go through all of those steps, but they do because it's not a mental problem. And so as a result, a lot of you start trying to solve it with your headspace. And the way you do it is you start to constantly telling yourself, what if it's going to go away? What if I will suddenly get better? What if it's not going to give me the results I want? All of this what ifs. So for those individuals who are so stuck, and if it's preventing you on going on hormones, this stuckness or this way approaching this as a problem you need to solve now, this is where, for those of you, starting feminizing hormones for a month or two and then stopping is a great option. Here's why. First of all of you need to know that starting and stopping hormones happens all the time. There's a lot of people have misconceptions that once you start hormones, there's no going back. It doesn't work like that. A ton of people stop hormones for many reasons. So stopping and it happens all of the time. Some people even achieve the changes they want and stop taking hormones. So it's very personal what your goals are, but starting and stopping hormones is again something that happens all of the time. Another reason why is because months or two is not a long time where you're going to get huge physical changes. What you will get is you're going to ideally get, and in my experience, majority by far people, I would say 95%, maybe 90% to be a little bit more conservative in this matter, get psychological benefits of hormones where they suddenly feel alleviation of dysphoric symptoms, such as they suddenly feel as if their mind is at peace. The anxiety that is constantly was in their mind in regard to gender tends to taper down. Suddenly people feel like they can focus and concentrate more. The mental fogness that they experience that they didn't even realize they had tends to dissipate. And people just generally feel almost like this feeling on edge that was present with dysphoria tends to go down once you start feminizing hormones. It is very common for a lot of you to start feminizing hormones. A lot of thinking functions do this all of the time. Start feminizing hormones, and then once you start feeling better and the absence of dysphoria, you start telling yourself you're cured. You start telling yourself dysphoria is gone, and you start telling yourself that you don't need to take any other steps forward because you're done. Dysphoria is not there. And so a lot of you stop hormones. What happens? And it's always happens in my experience. And if it didn't happen in your case, share below. But in my experience, so far I've seen it happen all of the time. Dysphoria always comes back, and a lot of times it can come back even stronger. Now, it may not come back immediately, week or months or 2 months after you stop hormones, but in my experience, it always does comes back in some shape or form. And that starts leaving person in this kind of discombobulated state of, hey, what's going on here? I was feeling great. Why am I suddenly feeling worse? So for those of individuals who are very thinking type, who are holding themselves back, who really want to start hormones, again, this is for those who do want and need hormones, but you're holding yourself back because you're rationalizing with yourself due to having the thinking function. My advice, start hormones, and then, sorry, I have a candle burning and it's starting to like flare out and it's bugging me, so I gotta put a lid in it. So for those of you who holding yourself back, my recommendation, start feminizing hormones, give it even 1 month. If you're going to start feeling better, which I'm guessing you will, stop. Just stop. Why do I want you to stop? Because I actually want you to feel the comeback of dysphoria. Once you feel the comeback of dysphoria, what happens is that you will realize in your logical, analytical, thinking brain, you will realize that hormones really do work. Because while you were on hormones, dysphoria was absent. When you then went off hormones, dysphoria came back. So this is a really great start and stop for those of you who are truly wondering whether hormones can benefit you on and whether it is a treatment option for you. It also can help you finally to commit to yourself. Why? Because prior to studying hormones, you're constantly in the state of analysis paralysis, right? Or paralysis analysis, that always flips to where you're overthinking everything, and you're overthinking everything to the point where now it gets to the place where it just paralyzes you in your tracks to move forward. Then when you start hormones and you start feeling better and you realize that they're working, and then you stop hormones, for you, the reason why it helps you to commit is that it takes the thinking loop out of your headspace of what if dysphoria can suddenly just be cured, all of those things you're telling yourself, all of the things you're bargaining with yourself. It gives you actual fact-oriented information that hormones are working for you, and that factual information helps you stick to it and be committed to yourself, because you already know stopping hormones, what it does to you, which in your case, for a lot of you, is going to be dysphoria comes back. And so this is why for individuals who are thinking oriented, who are very stuck and holding themselves back from moving forward because you're overanalyzing everything, this is why starting feminizing hormones for even 1 month and seeing the benefits and then stopping and waiting for dysphoria to come back is helpful, because it gives you the tangible proof that this is the path forward. It breaks that cycle of questioning, it breaks that cycle of constantly going back and forth in your mind. Those of you who are watching, who have started and stopped hormones and experienced this, know this. Comment below and share exactly how it felt for you. This is something that a lot of people tend to do this. So many clients I see who come to me to work with me and they say, I actually done hormones X amount months ago, and then I stopped. And when I stopped, I didn't have dysphoria for some time, and so I thought I was cured, and I thought that I didn't need anything else, and then it came back. This is something that's very, very, very common. And a lot of times it's an indicator to a lot of the thinking types that this is not just going to go away. This is something that really needs to be addressed, whether you step into hormones or whether you decide to acknowledge that it's going to be there and find different way to cope with it. But this is not just something that's going to suddenly vanish by itself. So comment below, share your experiences, give me thumbs up or give me thumbs down for the vampy look. I promise you, I don't get offended at all. I would just be very curious and intrigued to hear your responses. I love this look. If this is not your cup of tea, that's all valid, that's all good. I'm the one who gets to wear it. So if you're gonna give me thumbs down, no offense at all, I'll just take it as the vampy look is not for everybody. So comment below, share, and I look forward to seeing all of you in the next video. Goodbye.